Okay. Good morning. Is everyone set? Yeah? Good to go. Excellent. Well, before we talk about today's exciting milestone, let me just let Queenslanders know that we have 5 new cases of COVID-19 overnight. They are all return travellers in hotel quarantine. 3 of them tested positive on day 1 though, which means that they were likely to be infectious on their flights, and so we'll be obviously closely monitoring other passengers on those planes. We continue to closely monitor the situation in New South Wales. Pleasingly, the ongoing monitoring of sewerage indicates that the outbreak there is largely contained to Greater Sydney, meaning that the restrictions in place in Greater Sydney mean that we don't yet need to put in place greater border restrictions here. New South Wales, though, has issued a large number of additional venues for contact tracing. We'd urge anyone who's been in New South Wales to check that list. There is particularly a number south of Sydney to Melbourne along the highway to Melbourne from that removalist who travelled into Melbourne, and so we'd urge people who might have been in those locations to check that list. But today's announcement is all about the Health and Knowledge Precinct here on the Gold Coast, a fantastic legacy of the Commonwealth Games. And today we're announcing 3 key new tenants here in the precinct as part of a new $80 million development. Construction starts here today. There'll be 180 construction jobs on a new health and early education facility that will be fantastic for children on the Gold Coast and in the wider region. It will include an early childhood and education centre, and co-located with that centre will be a wide range of specialist and allied health services that those children can access. So it'll be a fantastic facility for children with special needs, children with a disability, and children suffering from chronic illnesses. Of course, co-located right here with the Gold Coast University Hospital, where many of them will be getting treatment, and with the Griffith University campus here, with the medical school and, of course, other health research and training faculty. The opportunity to have all of them together will deliver fantastic services. We expect that once it's up and running, there'll be 900 health and teaching and other people employed, the professions employed here at this facility. We're also in the process of finalising tenancy agreements for an aged care facility and 4 other commercial in confidence arrangements. Really just showing how this precinct is coming together and will be a fantastic long-term legacy for the Gold Coast, employing thousands of people.
Thanks, Deputy Premier. It's a great day for the Gold Coast with the sod turning here and, of course, the State of Origin tonight. As the Deputy Premier just said, this is a great legacy for the Gold Coast and obviously was a key part of the Commonwealth Games to turn this into a health and knowledge precinct that provides long-term good jobs and a new industry right here in our city. My brother has a disability, and on the Gold Coast we had to travel to a range of different services from physiotherapy to speech therapy. So having a facility all under the one roof really makes sense, and it's really exciting that we're going to have this Australian first facility right here on the Gold Coast, and want to thank the investors and of course partners. It makes sense to have those connections so close to both the private and public hospital here as well as Griffith University, with the light rail linking everything together. It is a really wonderful new development that's happening right here in our city on the Gold Coast. Of course, as the Deputy Premier just said, there's a number of construction jobs, but it's also those ongoing jobs, the 900 professional jobs that provide stability for young Gold Coasters who are studying perhaps at Griffith University, who can find employment at places like this. So this is a great win for the Gold Coast, and just want to thank everyone who's been involved.
Good. Thank you, Deputy Premier and Premier. You've already heard this is going to be more than simply a building. The fact that Sanctuary Childcare is going to not only provide childcare facilities here, but it's going to be integrated with special allied health services for those children, those toddlers with special needs. it's a unique approach to providing childcare, and it really fits in with the policies and philosophy of both Griffith University and Gold Coast Health. It's not often you can come to a childcare facility and those children with special needs have all the services provided in the one building. So when you look at that building, forget about the structure. Just remember the services, the unique services it's going to provide, and how it's going to capitalise on the proximity of both Gold Coast Health and Griffith University.
Thank you, Deputy Premier and Minister Scanlon. Griffith University has a really deep and long commitment to inclusive education and to research and capacity building to ensure that all Australians have the fullest opportunity to engage with their society. About 4% of Queensland children have special needs, and about half of those have severe needs. This building and this research centre will create a centre of excellence where we will bring together children, families, health experts, researchers in health, researchers in education, and also the people who are teaching the next generation of preschool teachers to ensure that we can give the very best to those children. We all want every child in Queensland to be able to learn, to reach their full health potential, to play and to enjoy their time before school. With this building today and with the partnerships that we've all formed, we come a step closer to doing that. Griffith is delighted to be part of that.
Yeah, good morning, Matt Evans, Evans Long, the property developer. I'd like to thank the Deputy Premier and Minister Scanlon for your time today and for your investment in infrastructure. Probably a buzzword today is legacy, and the infrastructure that you've created here is amazing. I don't know anywhere else in Australia as a health and education developer where there's such a platform here to take forward. You've left us a great legacy in terms of being able to co-locate with Gold Coast University Hospital and also Griffith Uni, two amazing partners. So for us, we feel quite privileged to undertake this opportunity. It's definitely the most exciting project that we've undertaken, because I think the end effect it'll have on people's lives and children's lives. And we've been very, I guess, fortunate to find such a great operator in Sanctuary Early Learning, who have also along the way developed a working relationship and brief with Griffith Uni and Queensland Health. So this building's all about changing lives. We can't wait to get it finished, can't wait to get started. And I must thank once again the state government for creating such a fantastic infrastructure platform. Infrastructure creates jobs when it's being created, and it creates that legacy for us to go on and create further jobs through construction and obviously when the building's complete. Massive thanks to EDQ, Jason, Liesl and Stephen. Part of, I guess, delivery of that infrastructure is getting a great team together to help it to be delivered. You've been nothing but professional and supportive of us. We finally got here, and we really look forward to making the next step. Professor Scuffman, from day one, meeting the early days of when COVID hit, and I know we all know what's happened to the tertiary sector, and to stay on track and supportive of us is much appreciated, and thank you very much, Carolyn, as well. It's just been an amazing, I guess, vindication of what we're doing here. And also with Queensland Health, we've just been overwhelmed with the support and staying true. So we really look forward to finishing this building and helping to complement the amazing existing infrastructure within the precinct. Thank you.
Happy to take questions on this first and then other things. Anything on this? I might leave that to the developer. Do you want to?
Yep, sorry. First quarter 2023. Yeah, we've got about a 15-month building program. We'll be on site September this year to take external further works in terms of excavation, and we've got a bit of float in there for wet weather, so hopefully we can bring it in a little bit quicker than that.
There's been a few, I guess, complaints from residents that parking is sort of scarce in this complex. How do you aim to address it when you move more people into this space?
We've got over 180 car parks on site, and I think with the precinct being medical and allied health, there'll be a fair bit of shared car parking. So one trip to this building will also see that person utilising some of the other resources in the centre, in the precinct.
Anything else?
Plus, you've also got an amazing public transport as a Sunshine Coast born person. We often very jealous of the infrastructure you got down here, so it is amazing. Yeah.
Yeah, sure.
It's great the NRL's here and Origins here, but in relation to the NRL hub, where it's been set up on the Sunshine Coast, a family had been booked in for a wedding. A bunch of wedding guests have been kicked out overnight. They scanned out by email. They had to be out the next day. Is that fair on that family? And what should be done with that?
Look, obviously there weren't 3 empty resorts or hotels that the NRL could move into, and so that has meant that some guests and reservations have been displaced. I'd simply call upon the NRL to do everything that they can to accommodate this wedding, to help them to find an alternative venue, and to appropriately assist them and compensate them.
Given the Sydney outbreak and concerns that symptomatic people are going in and getting tested, is there an argument that at-home testing for COVID should be approved here in Australia? I know LU, Queensland companies developed the tests and sold them to the US where they're using them.
Yeah. Look, Illum is a fantastic Queensland success story and has been a game changer in other countries where they are experiencing very, very high levels of COVID. We have to remember that even though we are currently experiencing Australia's third wave in Sydney, they are still relatively low numbers when compared with other countries, and so we have very high levels of capacity within the existing testing platforms. Those testing platforms have a very high level of accuracy and they are very, very reliable, and so while we don't have those levels of outbreaks in other countries, it makes sense to continue to rely on the in-person testing facilities that have served us incredibly well. They're delivered both by Queensland Health and by our private pathology partners in Queensland, primarily QML and SNP. They've all done a really fantastic job.
Just on hospital wait times,
Sorry, can we just keep going with COVID before we go?
I'm happy to come.
are you right to answer my question?
Sure, okay, yep. Okay, I'll come over.
Hospital wait
I'll let you guys sort it out.
shows 1 in 4 Queensland patients aren't seen within the recommended timeframes. Is the state government losing control of the healthcare system?
Look, I think the one thing Queenslanders know from the last 18 months or so is that we have one of the best health systems in the world. It's a health system that has served us very, very well. What they also know is that when they need treatment and care, they get the very best treatment and care from our very, very dedicated health staff. They do a fantastic job. Part of their job is ensuring that people are seen in the order of their urgency based on the treatment that they need, and that means that if people need a treatment that is less urgent, sometimes they'll need to wait longer. But for most people, and certainly in the most critical of cases, they get seen within 2 minutes. It's quite an incredible service.
Sorry. So back to COVID.
Okay.
We're seeing wealthy people come into Queensland illegally. They're being fined $4,000. Is a $4,000 fine enough of a deterrent for people with these needs?
Yeah, look, I don't think there is a way to means test penalties, which is what you'd need to be able to do to make the penalty an appropriate deterrent in those circumstances. $4,000 is still a pretty big fine for most of us. Certainly that would be a deterrent for me. And you've also got to remember, these people are now going to have to spend 2 weeks in hotel quarantine, and as much as we try to make hotel quarantine as comfortable as possible, it's certainly nothing like sitting on a super yacht.
Anthony McCormack is a very high-profile case recently where he was denied an exemption to come back and see his dying mother in that's passed. There's been a bit of back and forth between the King and Queensland Health. The line from the government has always been that you're always in conversation with New South Wales to try and sort things out, but he's got emails showing that his request was denied. Where's the truth?
Look, obviously I'm not across the kind of day-to-day detail of those interactions. What I know from my time as Health Minister and from dealing with the current Health Minister and the Chief Health Officer every single day still is that they endeavour to deal with these situations with as much compassion as is possible, while also keeping the community safe. And while every one of these circumstances is tragic, and this pandemic has affected people right around the world, sometimes at the most difficult times of their lives. I know that Dr. Jeanette Young does her very best to make sure that everyone is dealt with compassionately.
On the border, is there a particular event that would have to trigger another hard border closure, an event, a case, north or just exposure sites? What would have to happen? Say, for example, if, say, between Sydney and Melbourne, there's some exposure sites on the highway, would that be enough?
Well, not exposure sites. We have exposure sites now on the highway between Sydney and Melbourne. What the Chief Health Officer has said that she's monitoring very closely is the sewage test results in regional New South Wales, so outside of that lockdown area. And obviously, if we started to see concerning sewage test results, well, that would be one consideration, particularly if they were outside of the lockdown area. While the cases are confined to the lockdown area, we don't need to put restrictions in place because the Sydney restrictions do their job. They hold people in those areas. Obviously, if New South Wales opted to lift those lockdown restrictions, well then we would need to reconsider, as well as if we saw positive cases, a cluster for example, north of Sydney or in regional New South Wales. They're the kinds of things that Dr. Young is monitoring every day in her AHPPC meetings and her discussions with New South Wales.
If we were to go back to that hard border closure, would you be hoping to keep up the border bubble between Queensland and Gold Coast?
Look, I think the border bubble served us very well. I think we learned a lot about how to put those restrictions in place last year. Sometimes it didn't go as smoothly as we would have wanted to, but it did serve us very well. And so I think the fact that we have the border declaration pass ongoing, so that's a requirement that is there now, as well as probably keeping a border bubble in place. But again, that would depend on the circumstances. If there was an outbreak within that border bubble, then obviously we'd have to reconsider how that might work.
We've seen some federal government support put in last year for small businesses behind COVID. How do you see that retroactively applied to businesses in places like the Gold Coast? Or is that not possible?
Yeah, look, there has been, I think, a lot of commentary already about why Sydney and New South Wales has been treated differently to Queensland and in particular Victoria. And I note the comments the Premier there has made. I think it's somewhat understandable that Scott Morrison feels a bit more responsible for the Sydney outbreak, given he urged the Premier to delay the lockdown there, and I suspect that's one of the reasons that he's chosen to step in there and provide additional compensation. I've seen this morning that they've indicated that those arrangements will now be available in other states should they go into longer lockdowns. Obviously, we'd welcome that. We'd certainly always obviously welcome consideration from the Commonwealth for Queensland businesses that have been impacted.
There was a story on our news last night, a video that's been circulating of a 13-year-old girl who was viciously assaulted outside her school. At this stage, it seems like those students have got off scot-free. Is that correct?
First of all, can I say that I think that situation, that footage is incredibly sad. I've got a 13-year-old kid. No 13-year-old should experience what that footage shows. I'm assured that while the people in that footage go to different schools, each of those schools is working through their respective disciplinary policies, and that discipline will be applied. But you've also got to remember this happened, outside of school. This wasn't a schoolyard incident, and I think the questions really are broader questions for our society, for these families, for the kind of situations the kind of circumstances that can lead to this situation. And really, my heart just goes out to the people affected.
Since that story did go to air last night, we've been inundated with messages from parents saying the government isn't doing enough to stamp out bullying and violence at school. Why is it not?
Well, as I've said, no child should have to put up with this kind of bullying. Our schools do a lot of work to try to stamp out bullying, but our schools can't fix everything. This didn't happen at school, as it happened at a shopping centre. Schools have a role to play, but so do families, so does the wider society, so indeed does the media. And look, I think if anything, this should trigger a wider conversation about the kind of circumstances that can lead to a 13-year-old child experiencing this kind of violence. Everyone good?
Get moving, yeah, thanks.
Thank you.
Okay.
Oh, a shovel.
Shovel. I'll take that. Shovel. There's your little
What would
pile
these
of dirt.